Are rising Medicare supplement premiums cutting into your budget? Let's talk about how you can save money without waiting for enrollment periods. Hey, thank you for visiting my channel. This is Medicare with Rick. I'm Rick Yutzy with LegacyCare Insurance. My channel talks about Medicare, educating you on Medicare, hopefully answering some of your questions. So this video is talking about the concern of rising Medicare supplement costs, or otherwise known as Medigap plans. I want to share a real life example of someone who called me just last week saying that they've only been on Medicare supplement plan for 3 years and their premiums have just skyrocketed over that time. And they said, unfortunately, we can't do anything about it until October. So would you please keep us in mind come the fall? And I was like, wait a minute. That's a common misconception a lot of people have, is that they have to wait until October to be able to change Medigap plans. But Medigap does not fall under the same regulations and open enrollment periods, or the AEP, that Advantage plans and prescription drug plans do. You can change your Medigap plan any time of the year. So that's the good news, right? So why continue to lose money and wait for 6 to 9 months in order to be able to try and lower your premiums? And so here are some key facts for Medigap plans that are important to keep in mind. One is, as I've already stated, you can change the plan at any time. 2 is, it's standardized coverage. A Plan G, for instance, there's multiple plans under the Medigap umbrella that are all regulated by the government. The 2 most popular are Plan G and Plan N. So a Plan G, and I will get into more details in later videos on what the differences are between these plans. But for now, just know that a Plan G is a Plan G no matter which insurance carrier you are with. Now, the premiums may change, but the plan has to cover the same thing. The coverage has to be identical with these plans. So a Plan G is the same with Company A as Company B. A Plan N is also the same between Company A and B. And so just keep that in mind. It's standardized coverage. You can save money by switching carriers or even going from one plan to another if you understand what the differences are in those plans. The third key fact about Medigap plans is eligibility. So when you change Medigap plans, it's a little different than changing Advantage plans. When you change an Advantage plan during a valid enrollment period, you can basically change to any other Advantage plan, any other carrier. They don't ask you medical questions, right? You're able to make that change. But with Medigap plans, your health matters. And so they will, at least in the state of Ohio, they will ask you medical questions. And depending on how you answer those questions depends on whether you are eligible to switch plans or not, whether they'll deny you or whether they'll charge a higher rate, put you in a different class so that you have to pay a higher rate. So it's important that while you're relatively healthy, that if your premiums are really cramping your budget, that you start looking around at that point, because if you wait until you have a major health crisis, it's going to be too late. You probably will not be able to change at that point. So it's important to know that while you're relatively healthy, you'll probably be able to pass underwriting and you'll be able to take advantage of some savings. So why does all this matter? It matters because the premiums for Medigap plans increase over time. And with some insurance carriers, it increases more than others. So all of a sudden now you could be paying more for your Medigap plan than you need to for the same coverage with another carrier. And so being able to switch plans or carriers is an important factor. And so I can help quote those opportunities, be able to quote and compare plans with you to help determine what is the best approach for you. What are the next steps that you can take? Guide you through the application process to make sure you follow these steps in the right order, because you do not want to get it wrong, because you don't want one plan canceled before another takes effect. And so with all of this in mind, who doesn't want to save plenty for the same coverage? So don't let those high premiums drain your wallet any longer. You can contact me today to explore what your options are and maybe start saving if we can find a plan or a carrier that is more conducive to your needs. So if this video was a help to you, If it answered some of your questions, could you please hit the like button below? Also, on a weekly basis, I'm going to be releasing new content on Medicare. And so if you subscribe, you'll be notified of those new videos as they come out so you don't miss anything. So it would be great and it would help me out tremendously if you like and subscribe below. Also, if what you heard today makes you think, hey, maybe I can save money. Maybe I should talk to someone to see if I'm paying too much for my Medigap policy and what are my options. If that's the case for you, call the number below and we can schedule an appointment to be able to answer your questions or to help you enroll in a new plan. There's absolutely no cost to you for my services, no obligation whatsoever. So thank you for watching.